LifeGuard is a single-base helicopter air medical service. We are staffed 24/7 with a nurse, a paramedic, and a pilot. We provide advanced level critical care to Eastern Iowa, as well as providing interfacility transports outside of the state as far away as Rochester, Chicago, and St. Louis. LifeGuard's been in business for about 35 years now. Initially it was staffed by paramedics with a pilot, and over the years we moved more into the traditional model that you see now, where we fly with a nurse, a paramedic, and a pilot.
My primary goal as the medical director is to make sure that my crew maintains a high level of proficiency and skill in the day-to-day business that we do, which is taking care of critically ill patients. When a basic paramedic service or a first responding service gets to a person's home and realizes that they are in significant trouble from a medical standpoint, they can get us in the air and get us there, and we can start providing that state-of-the-art care on the scene and en route back to the hospital, and really start that patient on the road to recovery that much sooner.
Our teams are in a 24/7 response mode. So when that call comes in, our staff are able to walk away from whatever we're doing, get our equipment to the aircraft, and lift off within a few minutes.
So the sooner we get medical care to people who have been involved in traumatic incidents, the better the outcomes are. We've got that ability with our speed to really be involved in that first hour of care of a patient that suffered a trauma, and ultimately down the road to ensure a better outcome by getting them to that definitive care more quickly.
Safety is our #1 issue that we deal with when we're working with air medical transport. The pilot does a very careful risk assessment looking at weather and all of the possibilities that these teams need to look at. So every type of emergency has a time element tied into it. People that have had a stroke, the entire time that they're out of facilities or they're away from an advanced level care facility, there's brain tissue that's dying. We need that air medical to be able to get them from one site to another site very, very quickly, as well as the ability to provide that critical level of care in between.
We do truly want to provide the care that we'd want our loved ones to receive if they were in a car accident or they had a terrible medical condition that they needed to be treated quickly for. Our paramedics, our first responders on scene provide excellent care to patients. The community should feel like they're in good hands with these folks. We can provide both the speed and the kind of increased level of care at times for these patients to transport them in.
To know that you make a difference in somebody's life on probably the worst day of their lives is huge. And as an emergency department nurse for 35 years, as a transport nurse for the last 16 years, that's a piece that is so special that I'll never give up.
There's nothing like being in the community and having someone come up to you when they see that you're wearing a LifeGuard t-shirt or a LifeGuard ball cap and saying, "You saved my loved one's life." To see that look on their face of the appreciation, that means everything to us, because that's why we come to work every day.